Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is about all breast cancer and how to detect and prevent it in an early stage. For this, I now welcome our expertise, who is none other our super top-notch senior consultant, Dr. Sachin Mardaji, who is a robotic surgeon, surgical oncologist from Yashoda Hospital, Somachigoda unit. I welcome you, sir. We are honored to have you with us today.
Thank you, madam. Thank you.
Yes. And we do have speakers from different state. We have from Tripura, we have from Prakasham district, and we do have from Chennai. I think, yeah, it is Puttur, Tirupati. Yes. So, yeah, I request all the speakers to introduce one by one. Yes. Over to you, Manucha, first.
Thank you so much. Good afternoon, sir, and good afternoon. And myself, Manisha Sarkar. I am tutor from Tripura Institute of Medical Science, and it is my pleasure to join you.
Yes. You all can be just little loud also. Please feel free to have your, insight. You can ask from our expertise, who is none other Dr. Sachin. Yes, over to you, Mahima.
Very good afternoon, sir and ma'am, and all other speakers. Myself, Mahima, uh, working as a nursing tutor in KKC College of Nursing, Puttur.
And Srinivaslu, we do have Srinivaslu, who is working in the government sector as National Health Mission. Yes, Srinivaslu, over to you.
Good afternoon, sir, and good afternoon, ma'am, and good afternoon, all. I'm Srinivasa from Andhra Pradesh.
Yeah.
I'm working as nursing unit.
Yes, great. So we will have this discussion one by one. So let us begin with the current prevalence by whatever the guidelines are now. Only sir can just give us the details. Like, yes, sir. We just like to understand what is the current prevalence for this breast cancer among female gender. Yes, sir. Over to you, sir, for your insight.
Yes, now thanks for having me on the board. And I saw a lot of young enthusiasts from all over India. So it's good discussion that as a healthcare worker, we should know about the breast cancer. Then only we will propagate our knowledge through this audiovisual media. And I'm very congratulating all the team behind this for taking the knowledge to the every corner of the country, maybe. So yes, breast cancer is increasing initially. Say when I was doing my MBBS, MD, MS, that time the uterine cancer, cervical cancers were little more, but now over the period of time in last 20 years, breast cancer is number one now cancer in not only India but all over the world. And the other issue is initially we used to see the old generation, maybe around 60, 70 years old cancer patients. But now in last 10 years, we are seeing the demographic change from the old age to the younger age. We have seen
Younger
now the
age.
incidence is around 20, 30, 40 is now 40 to 50 is most common breast cancers are coming. And now as per
Yes.
the latest GlobeCan data, whatever we have, so around 20, one in 20 female will have a risk of breast cancer. That is the incidence in the current situation.
Yes. So, yes, sir, that is rightly as said, since 10 years onwards, we are seeing the demographic changes among this rise of breast cancer. Yes, going forward, we have Mahima who wish to understand the right, scenario and definition of breast cancer. Yes, over to you, Mahima.
Sir, good afternoon, sir.
Good
So,
afternoon.
You're
sir,
not
let me
visible,
know
Mahima. Mahima, you're not
ma'am,
visible. Just turn on your camera. Yes.
am I visible, ma'am?
Yes.
Yes.
Sir, good afternoon. Sir, can I know the exact and accurate definition of this breast cancer?
Yes. So any cancer, not only breast cancer, but what is a cancer is in layman's language is abnormal uncontrolled growth of cells. That is a cancer. See, in body by nature, we have given every cell a particular span. Like for example, RBC will have a 120-day span. After 120 days, automatically it will die. That is called as apoptosis. So suppose the cells doesn't die and just it produce one cell to two cell to four cell and it will form one lump that is called as cancer. And the problem with the cancer is it won't stay at one place. There is a tendency that it invades the basement membrane and it goes to the surrounding structures, nodes, and other organs. So that is the definition of breast cancer and metastasis.
Thank you, sir.
So I think hopefully you understood, I think, Mahima. Yes?
Yes, ma'am.
Yes.
Thank you, sir.
So yes, going forward, sir, I was just going through, and we did celebrated last 2 weeks, 2 months, like the Breast Cancer Awareness Month, and I was just
Yeah.
going through this theme that like every story is unique and every journey matters. Like, how would we understand this as, sir? Like, is this a journey of the cancer survivor, the female who goes through a lot of hardship? Yes, sir. Over to you in a simple term. We would like to understand.
Yes. Uh, Absolutely true that every patient is a different patient, every story is a unique because uh, we see the patient holistically, not only breast cancer, right side, left side. It's not like that. Every breast cancer now, there are so many medically, genetically, and immunologically different definitions. Like we do the markers, ER, PR, HER, triple negative, triple positive, double negative, all those things now. Breast cancer is a just a general term, but there are 20 subtypes of the breast cancer. So accordingly, we treat. So that is of the breast tumor per se. And also every story is unique and every journey matters. Why? Because I have seen a patient right from 24-year age, which is unmarried dentist, to a 70, 80-year-old grandmother. So the treatment given to the young patient would be different. Treatment given to the old patient would be little different depending on her age, her molecular analysis, her stage of the disease. So it's not per se. It looks like very common breast cancer, but there are different aspects, fabrics, and different colors to that. And when we unfold it, really it is very inspiring. And I have seen so many young patients who have came from this dreaded disease because it's not only uh, physical disease. Breast is very important organ for any female. So, patience, it is a symbol of love, it is symbol of affection, it's symbol of motherhood. And the female carries the confidence and the body language when they have a good, nice cosmetic. And
Yes.
now
Yes.
almost 60-70% women, they are working. So when they go into the office, into the whatever job you are doing, you need to carry your right body language, and that's why now we are doing more of breast conservative surgeries, plastic surgeries, breast reconstruction, all those things. And that's why. And who other than I know that it is every journey is unique, because I have written one book also on this. I am Unstoppable, where we have figured different patients and their own journeys, their own emotions, and I think that is highly inspiring.
Yeah, as well, your productive, inspiring message also is very inspiring, sir. Yes, we have Tripura expertise who is from Tripura, Manisha. Yes, over to you, Manisha. What you wish to understand from our expertise? Yeah.
Good afternoon, sir. But we know that the different aspects is there, but always the breast cancer is hereditary.
Not all cancers are hereditary, but see, there is difference between the familial history and hereditary cancer. You may have a family history of one or two members which have diagnosed with the cancer, but it doesn't mean necessarily that the breast cancer is hereditary and it will come into the next generation. There's a classical definition of hereditary breast cancer. For example, more than three generations and more than three members in family, they are diagnosed with the cancer, then we tell it as a hereditary cancer. And also now, as you have mentioned, like there are different genes, BRCA1, BRCA2 genes, HBOC, hereditary breast ovarian cancer syndrome. Mahima, have you heard the name of Angelina Jolie?
Yeah.
Angelina Jolie. Yes, sir. Yes.
Yes, yes. So she is a very popular cinema actress in celebrity in USA. So she had the same issue. She had BRCA1, BRCA2 genes positive, and what she did is because there's a risk normal 96% risk is there if you have a BRCA1, BRCA2 gene
Yes.
positive for breast cancer and ovarian cancer. So now we are propagating prophylactic risk reduction mastectomies. So like that, he underwent bilateral breast removal without any disease and then got reconstructed of the breast. So that is now there is that effect is also called as Angelina Jolie effect that time. So these are few cancers, almost 3 to 5% cancers. They are hereditary cancers. We need to look our family history carefully. And now good news is these tests are available everywhere. And another good news is there are geneticians who takes care of such cases, who take the family history detail and then they counsel to the patient what has to be done next.
Yes. So, sir, as a expertise, do you also, suggest or advise your, clients who comes in for this, like what step has been taken by Angelina Jolie, like total, risk reduction surgery. So, do you also prescribe or do you suggest?
Uh,
Maybe this is my, doubt I wish to ask
No,
because,
no, that is correct.
yeah,
Now, because now this patients in last 1 year, I have operated two patients, same like this, and then we counsel the patient. See, there is a
yes,
risk of this, whether to want to do it or you want to be under follow up, everything every regularly 3 months, 6 months. That is a your call. But
yes,
few patients they are ready to do surgery, get removal, and they get reconstructed. And few patients they are little scared or they don't want unnecessarily surgery when it is not there. So
yes.
they are both categories of patients. But as if there is strong family history and if BRCA1, BRCA2 is positive, then we at least advise the patient and we do tell them to go and meet genetician. They will advise you further.
Yeah, yeah, very interesting, sir. Yes. Srinivaslu, the other side, we have Srinivaslu. Yes, Srinivaslu, over to you.
Sir, is there any early warning signs and symptoms, sir, for finding cancer?
Yes. Um, Always the problem with the cancer is most of the cancerous lump or ulcers, they are painless. And that's where
Yes,
the general routine public go, neglect. Because if there
neglect,
is
yes.
any lump, for example, if you have small, tooth ulcer or some tongue ulcer or office ulcer, there will be lot of pain and you'll go to the patient, doctor for that pain. But
Yes,
unfortunately, in cancer, the pain comes in the last initial stages, breast lump or any other lump, there will not be a pain. So any breast lump after age of especially 40, 50 is little suspicious. Second, any red colored nipple discharge, any axillary nodes that or any supraclavicular nodes, or there is a weight loss, loss of appetite, swelling, generalized swelling in the breast. So these are few signs and symptoms of breast cancer. And if such lesions are there or if there are such warning signs are there, we have to tell the patients to go and meet the physician or oncologist and take further tests.
yes, yes. And yes, sir. And yes, Manisha, over to you for your insight. Yes. Whether you would like to
Sir,
ask
you
this? Yes.
sir, you told that any type of lump. So every lump for breast cancer. That is, we have to say that lumps present. That means breast cancer is there.
No, Manisha, it's not like
Yes.
that. It is, see, there are few breast lump which are there in the young, age around
Yes.
15, 20, 25, 30. So they are normal lumps. We call them as the fibroadenoma or fibroadenosis. They are not malignant lump, but those who comes after 40, 50, little hard and they are not mobile. See, normal lumps, they are mobile, but the
They'll
breast cancer
mobile.
lump, they don't freely mobile. So these lumps have a tendency to become cancer. So out of 10 breast lump, only one could be a cancer. Rest 9 will be a benign. So every breast lump does not necessarily means that it is cancer, but there are few risk factors which already told. If they are there, then the suspiciousness increases and then we have to do some test.
Yes. From for the male aspects, yes, Srinivaslu, do you have this concern of this slide? Yes. Over to you. Yes, Srinivaslu.
Ma'am.
Yes. So, sir, as you were, discussing rightly, right from the prevalence, can men also get breast cancer? And if so, what are the causes and what are the predisposing risk factors, sir?
Yes, yes, men also do get breast cancer very, very rarely. In last 20 years, I have operated around 10 to 15 cases of male breast cancer. And this is again a problem. Men think that there is no breast, so they will not have a breast cancer. But male also have a breast. Only thing is they don't have the milk secreting part,
Yes.
which is required for the lactation. So that part is not there. But the other
Miriam?
breast parenchyma is still there, so men also can get breast cancer. Only thing is, because in male there is not much fat compared to female, so small lump they can easily get detected. So such lumps the male comes and then they get detected. The risk factor is bilateral gynecomastia. There is like the
Yes.
diffuse enlargement of the breast in males. Sometimes that could be a diffuse risk factors, and again, as other risk factors, smoking, alcohol, all other things are also there. And the
Yes.
treatment will be exactly same as female breast cancer. We have to remove it, we have to give some chemotherapy and oral therapy. Exact the treatment is same.
So, sir, to be safer side, these childhood, like we see early adults also, they have, gynecomastia conditions. So,
Mhm.
should they see a doctor and should also they go for conservative or surgical options like removal or suctioning of fats or like,
Yeah,
yes,
this is a very good question. There are two types of gynecomastias. If it
yes,
is a symmetrical, bilateral looking normal gynecomastia, that is not a risk factor for breast cancer. But
yes,
asymmetric gynecomastia, one breast is small, one breast is large, there is some lumpy swelling in the breast, lump below the nipple areola. So these asymmetrical heterogeneous gynecomastia will have a little more tendency to become breast cancer.
yes,
But except cosmetic reasons, I don't think there is any advice of doing liposuction and getting
yes.
out the. But there are people who can want to do it. Yes, that option is always available.
Yes, because we see these teenagers, they keep they bound to wear the dark, attire so that they don't look odd in the in front of their friends and all. But as you rightly said, I will just give this message also to them: symmetrical versus asymmetrical. Thank you for that. As yes,
Yes.
Mahima, over to you.
Sir, again, how to diagnose it early, and how can we stop and prevent the risk of this breast cancer?
Yeah. So as any cancer, we tell them at least catch it young. That means first of all we have to prevent it. But unfortunately, if it is there, we have to catch it in very early stage so that the treatment will be little short, may not require multimodality treatment and all those things. So early diagnosis is very important, and we do two, three. There is called as triple, testing. First is self breast examination, which every female has to undergo a breast examination. Those who are premenopausal, so we advise them on a 10th day of their menses to do the breast self-examination. And there is a way by which how to do breast examination. It has to be done with the palms,
Yeah.
soft, and there are different mechanism. Either you go spirally or you go vertically, and the importance is to cover the whole area of the breast, including the axilla and the nose.
Excellent.
So that is self-breast examination. Second is mammography. Now there are two types of mammographies: conventional mammography and one is digital mammography. And we do oblique and straight views to see any small abnormal microcalcification or lumps in that. And third, if there is any suspicious thing, there is some criteria: BIRAD 1, 2, 3, 4, 5, 6. If more than BIRAD 3 or 4, we have to do a cytology or biopsy. You have to take some sample from the lump and send it for the laboratory, which our pathologist will confirm that it is benign or malignant. So these are the overall general initial test which we do, and then some scanning like PET scan and other things have to be done to stage the disease and then plan the treatment.
Yes. So, sir, I also wanted to understand, and it is maybe very beneficial for the viewers who are watching, on which
Yes.
day a girl should, or a woman should do this BSC, like breast self-examination, during their menstrual fifth or seventh day, or when, sir? I have heard also understanding from our surgeon that during shower it is good because you glide your fingers, as you rightly said, yes, sir, on which menstrual period day.
During
During shower.
yeah, yes,
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 because you can glide your fingers and privacy
correct.
is maintained, all that
Ex
aspects. Yes.
Exactly. So normally we advise them around 10th to 14th day of the menstrual cycle because that time the hormonal effect will be little less. The breast will be
Yes.
non-tender, they are soft,
Yes.
and every breast is different because some will be nodular, some will be fibro-fatty, some will be
Tuberous.
flat,
Yes.
some would be little hard. So you should know
Yes.
first what is normal to you.
Yes.
Correct. So that is important. What is your texture of the breast? You should know first, and then,
Yes.
as the diagram has shown, there are different and there are different techniques available which we can do the breast mammo,
Yes.
the self breast examination.
Yes. So, sir, you do a lot of, I see you visiting a lot of the other communities. You visit the schools, you give a lot of health talks and all. What is the awareness? Do you see this awareness among the school children, like right from 12 years of age? Are they practice? Do they practice, or I don't think
Uh,
that
no. Yeah,
awareness?
still, we are doing our hard efforts
Yes.
to carry this awareness to the society,
Yes.
but still, that I don't know what it is to
Yeah. What
explain.
stops them not doing?
Yeah, so
Yes.
I think still it is not into the DNA of the general people that they should first give priority to the health.
Yes. Yes.
So I think we keep more doing such kind of programs, and one
Yes.
day they will become
They
aware.
will have this, yeah, behavior of doing this. Yes. So yes, yes, Srinivaslu, do you want wish to ask this?
Yes, ma'am. Sir, is there any uses for reduced treatment
Yeah, I think
new
your
products
voice
or
is not.
anything?
Srivasu, your voice is not audible. Okay, on your behalf, I'll clear this. Like, sir, we do always have this myth and fact. Sometimes we hear from others, sometimes it is traditionally practiced, and we don't know until, as you said, 10 to 14 day, we should do this BSc. Yes, as you also have given your lecture on this cancer in among young adults, rising but preventable. What is your take on this, sir?
Yes. So now we are seeing so many cancers in the community that cancer has become now one of the chronic disease.
Yes,
We have one patient of diabetes in a family, one hypertension in family, one thyroid in family. Like that, now cancer will also become one
yes,
chronic disease in the family. So now the change is like initially once the cancer diagnosed, it is like death, but now
yes,
now it has turned from the death that cancer was there but he is living. So it is like people used to die with cancer, but now people will live with cancer. So that is the change has happened. But yes, even though the incidence has increased, but definitely it is still preventable. And there are a lot of myths and facts in the society, like few of them, like already you told,
yes.
men will not get the breast cancer, or any lump is not cancer or benign. Like that, if we do a biopsy, this is also very common. They ask, when we ask to do an FNS or biopsy, you don't, do the biopsy because it will spread. So it is
Yes,
also myth. It is not myth. Unless after biopsy you don't do the treatment, then it will spread. But if
yes,
after biopsy, if you start surgery or chemotherapy or radiation, whatever treatment, it won't spread. Again, there are many myths and facts about like excessive. There are I don't know how these fancy things come. Um, uh, People somewhere was asking me like hard bra or soft bra.
yes,
Can we?
lingeries, yes, yeah,
Yeah, the lingerie, when you wear such kind of thing, is there any difference? Or wearing a bra or not wearing a bra, is there any difference? So there are very
yes,
myths and facts are there in the society. I think it is our primary job to clear all those things.
yes, yes. And I like the way you, keep clearing this myth and fact in a very simple fashion of very crisp, reels, which is very much required nowadays because as awareness has to be reaching to all, group. Yes, yes. We do have again Manisha. Yes, Manisha, over to you. Manisha, are you there? Yes, so maybe, yes. So we also keep looking at this hormonal replacement therapy when the woman is, menopaused. So are
Yes.
these potential hormonal issues also can cause breast cancer, sir, and other deviations of
Ye-
lifestyle, as you said earlier? But we just wanted to understand about HRT. Yes, sir. And
Yes,
should the
yes.
women after menopause, is this a mandate that she should take HRT, sir?
No, there are studies and trials which shows that hormone replacement therapy is a risk factor for cancer. Now, there are two things, estrogen and progesterone, and only estrogen peaks. So, what kind of hormone replacement therapy you are taking, that depends
Yes.
on that. But yes, there are studies that shows that not only breast cancer, but uterine cancer is also one of the risk factor for hormone replacement therapy. So, what I always tell my patients that don't take the hormones after menopause, but then you take the phytoestrogens, not medicines, medical estrogens, but phytoestrogens, which are there in the plants and the seeds and the nuts. All those things, if we take, automatically it will be your estrogen level will be little higher than what it's. And so that is a natural way of taking some hormones, which will reduce the postmenopausal side effects. And again, uh, when it comes to the hormones, early menarche and late menopause is also one of the side risk factor,
Right.
because
Yes.
more the exposure of the estrogen to the body, again it causes the risk of the breast cancer. Then few
Yes.
other risk factors I want to mention is uh, late marriages and late pregnancies and
Yes.
first baby. This is very important. Why I'm stressing on this, because of whatever generation we are living, whatever societal pressure or whatever education, job opportunities, but we see now the kids, boys or girls, whoever they're getting married delayed because whatever reason, their academics or jobs. But then biological clock is something which I always tell. Chronological clock is, it will run, but biological clock is also important. So you
Yes.
have to get married in the time around 25, around 25, because that is the time the fertility is more. There's the time best having the best kids. And also now, because of various reasons, many girls, they don't do breastfeeding because of their cosmetics and because they want very, body uh, things,
Feministic issue.
feministic
Yes.
things and
Yeah.
all those things. So that is also, breastfeeding is actually good, and
Very
it
important.
reduces the breast cancer incidence.
Yes.
And then smoking, alcohol, that is also common in quite percentage in young females, especially those who are working IT industry and all. So these are all risk factors which are very important to prevent cancer.
Yes. So very, crucial slide we will be talking on. Yes, Mahima.
Sir,
Correct. Yeah.
let me know that which is the correct time and when we have to do the screen, the perfect time to screening this
Yes.
breast cancer.
Yes, screening, screening, what do you mean by screening? Screening means even though you don't have any problem, you go and check for
Yes.
some cancer test, that is called as screening. Like we check blood pressure, sugar, diabetes, cholesterol, thyroid, something like that. For cancer, there are few specific tests that is called as screening. And here we are talking about breast cancer. The mammography is one important screening modality. And in our data, in our research, it has shown that annual mammography after age of 45 or 50 does reduce it doesn't reduce the incidence, but at least is catch the disease
Detects.
early, detect
Yes.
early, so that early detection, only surgery will be sufficient. You may not go require the chemotherapy and radiation and advanced therapies. So that's why we always tell the patients to do screening mammography, as the slide mentions, around 45 to 50 age, every yearly once a mammogram. And the best way to do it is, I think I always talk about this in my talks and my conferences and where I meet, a beautiful gift to your loved ones on their birthday or on their wedding day or their anniversary. And in Yashoda Hospital, we do a lot of best women checkup, well women
Yes,
checkup.
yes,
So all those things, if we tell our family members, mother, grandmother, or wife, sister, whoever they are, to do the basic test, including the
yes.
oncology test, mammography, which will detect the disease early. So I think that is the key take on this mammography on my.
Yes, yes. Very, very productive tips, sir. As you said, yes, gifted to the loved ones. More than this, I don't think that there will be something. Yes, yes. So we have come to the nearing slides, so now we will be winding up. Yes, Srinivasulu. Yes, you wanted to
Sir,
understand
is there
this.
any
Yes,
surgical options?
yes, Srinivasulu.
Sir, is there any surgical options?
Safe surgical options
Ma'am,
and use of breast implants, sir. Yes,
Yes,
your insight on
yes.
the same. Yes.
Correct. So there are three or four main types of breast cancer surgery. What we do, one is modified radical mastectomy, where we remove all the breast, including nipple, areola, parenchyma, nodes. So on one side there will be normal breast, on other side there will be not breast. There are few indications, contraindication for this. Second is breast conservative surgery. So when we remove, that is called as oncoplasty. So when onco is oncological breast surgery, plasty is plastic surgery. So combining these two is oncoplasty surgery for breast cancer. So in women who are less than 60, small lump, adequately volume breast, but the volume of the tumor is small, so we can do the oncoplasty, keeping the good natural breast mold or symmetry as natural to that. That is second surgery, that is breast conservative surgery. Third is you do mastectomy, but then again you reconstruct the breast. Now there are another two types of reconstruction of breast. One is with your own body muscle fascia, like tram flap or lat darcy flap, we do it. And the other is implants. So adequate size volume implants, compared to the other side, we keep implants. So both three, four options are available depending on the patient, her background, everything we decide, and then we take a call on that. And the question about the targeted chemotherapy is, normally when we give chemotherapy, there are some potential side effects, because when it kills the cancer cells, it also kills the normal cells. That's why the hair loss is there. And all women are, most of the time, they are concerned with the hair loss when they do
Yes.
undergo chemotherapy. So now we have a newer varieties of drugs. They are targeted therapy, like HER. We have a trastuzumab and some other monoclonal
Perceptive. Yes.
antibodies, Herceptin. So they only kill the cancer cells, and the normal cells will be less damaged. So there will
Less
not be
damage.
side effects of those. So those drugs now we are using. And one more new thing I want to tell, that we have now scalp cooling technology for the hair loss. So when we give chemotherapy, we put a helmet, that is a scalp cooling helmet, so that the hair loss will be less. So that was about the chemotherapy and targeted therapy.
Yes, very great to know, sir. I will just further talk to you on this, sir. Scalp pulling helmet, sir. So
Yes,
during the chemotherapy, the woman should wear this and then the chemo will be received. Vice
yes,
versa for the different cycles, right, sir?
correct, correct.
Yes, yes. Yes, sir. Now, yes, at the end, yes, I was just trying to tell all these speakers. So this is a book which, sir was mentioning. I'm unstoppable. Together we can kill the cancer. So this
Yes,
was already launched. I was there witnessing the during the launch time. It is also available in the Amazon. If you happen to come to Hyderabad, please do visit, because we can give you this book as well. You can visit sir as well. And I urge all the participants to refer our website for more health talks, academics, and patients' experiences. Before that, sir, with this message, what are the few preventive and tips for health and happiness and exercise and precautions you would like to tell to pass on to the viewers? Yes.
yes, yes, yes. And also to add that, thank you, Shanti, that showing the book for the all our audience. And also one more good news is the book also
Oh,
in Telugu. One
Telugu.
of
Okay, sir.
yeah. So one of the health journalist, she
Yes.
came across that book, which was in Hindi, And then
Yeah.
she herself came and she told me that I'll translate free of cost for all the people in the Telangana and Andhra. So now this book is also available in Telugu. So and it's also available in Marathi, Hindi, and English and Telugu.
And
And
the name is I am unstoppable only. Telugulo
yes,
kuda?
yes, the same name on the pair is same.
Yes, yes,
But
yes.
otherwise everything is Telugu. So
Yes.
it can go
So
to
great.
every home in the Telugu states.
Yes.
And again, as you showed the
You-
last slides, that
Preventive steps. Yeah.
preventive tips.
Tips.
I think all of us know what how
Yes.
to live the healthy life and what to eat, what not to eat, and all the things we already know. But the problem is implementation. Execution is the issue. But just for sake of this talk, I'll just tell few things. One is having a healthy body and healthy mind. Both are required. So healthy body is eat proper diet. Dieting again now is a eating less is a diet, but eating it less is not dieting. Eating right is a diet, proper
Yes.
diet.
Yes.
So so that is one thing we have to introduce. Now there are so many girls or ladies who do dieting, but they are anemic, they are hypothyroid, and they are having very less of hemoglobin and all those things. So they do just on the name of diet they eat less, but the all proportion is not there. Again, second, uh, the portion control. Sometimes we tend to eat little more, and that will put on our body weight. So third is optimum body weight, because obesity, hyperweight or overweight is also risk factor for many cancers, including breast cancer and uterine cancer. Fourth, again, smoking, addictions, tobacco, all those things we have to keep under control. Our best weight is not to have those things. Regular physical activity, at least 20 minutes a day in a week. We have to do some sort of health related exercise. Maybe
Exercise.
maybe it would be a brisk walking or swimming, or for all the girls here, they love swim, dance, or
Mhm.
maybe shuttle playing. Some sort of physical activity is required, and also stretching, some meditation, pranayama, breathing exercise. All those things, if we keep doing, I think we will all be healthy and happy also.
Thank you so much for these beautiful productive insight from your answer and as well the tips. Yes, I like to thank all the viewers and the speakers as well from different state. And yes, please go through the book or anything, any sort of anything you can just ask us. We will also ask sir. Yes, thank you, sir. And we end the session. Thanks for your very valuable time for the participation, sir.
Thank you. Thank you. It was lovely, discussion. I enjoyed thoroughly with the questions, the discussion, and I hope and I'm sure that this webinar will definitely create awareness, and the purpose of
Yes,
this would be served to at a larger society.
yes,
So
sir.
thank you, Shanti, and all your background team, the audio visual team, the
Yes,
digital team of the Yashoda Hospital, all the participant Mahima, Srinivasulu, and all other
Manisha.
audience,
Yes,
Manisha, and thank you for the audience, because afternoon time you came here and saw this
yes,
audio visual webinar, and definitely it must have added few health tips which you
yes.
will personally implement and you also propagate to the
Yes,
society.
yes, yes,
Thank
sir.
you. Thank you.
Yes, thank you, sir. We end the session. Thank you, speakers. Thank you, sir.